acute cerebrovascular events, encephalitis, Guillain-Barré syndrome, acute necrotizing hemorrhagic encephalopathy, and hemophagocytic lymphohistiocytosis. Just some of the scary sounding neurological consequences of COVID-19 that have been described so far. Is there anything we can do with our diet and lifestyle to combat the effects of the novel coronavirus on the brain and nervous system? Watch on to find out. First upload for a while, guys. Delighted to be back sharing my thoughts on this topic with you. If you've been following my channel for a while, you will know that one of my biggest interests is brain health. It is the main reason I went from a laissez-faire junk food vegan diet to a whole foods plant-based diet, and one of my main motivations for starting this YouTube channel. I have discussed the impact our dietary and lifestyle choices have on our brains in some detail here previously. Naturally, it has been the aspect of COVID-19 I have been the most concerned about. The other organs such as the lungs, kidneys, liver and heart that we know can be affected by COVID-19 all have great regeneration potential in the patient recovering from the disease. The same cannot be said about the brain. Before we begin, I just want to warn you that I'll be flicking through the slides and touching on concepts fairly quickly to prevent this video from becoming excessively long, but feel free to pause at or review any part of the video if there's anything you are particularly interested in, and also be sure to leave any questions or comments you have if there's anything you would like clarification on. Of course, this virus has not been around long enough for us to fully understand what the long-term neurological consequences will be, but certainly given the growing body of literature describing acute effects, from case reports to series, to cohort studies and more recently systematic reviews, it is logical to presume that we are in for long-term sequelae as well down the road. It also follows that those concerned about brain health should be taking measures to prevent getting this virus very seriously, and also to optimise their ability to prevent these effects in the event that one does become infected. Indeed, if we consider the taxonomically similar causative coronaviruses in previous smaller outbreaks, we saw damage to the nervous system take many forms, including polyneuropathy, encephalitis, large artery ischemic stroke, brain swelling, ischemic changes of neurons, demyelination, insanity, seizures, disturbance of consciousness, paralysis, Guillain-Barré syndrome, and others. So what do we know about the potential for this disease to affect our brains so far? Well, first of all, if we take a step back and think about some of the most common symptoms that we now associate with COVID-19, it would seem that the disease does indeed have neurological consequences a significant portion of the time. In the acute phase, patients commonly suffer from fatigue, headache, and loss of senses of taste and smell, all of which could be due to the disease affecting the brain. In so-called long haulers, patients that have ongoing symptoms for sometimes months following infection, we have seen fatigue rank high up in reported symptoms in patients hospitalized with the disease, but also in younger cohorts tested in the outpatient setting, where once again we see neurological symptoms feature strongly weeks after initial infection. Given this frequency of symptoms suggesting central nervous involvement, it is no wonder that more serious, long-lasting, and devastating neurological consequences of the disease have also been described, and we may be in for a crashing wave of neuropsychiatric sequelae such as depression, anxiety, and trauma-related disorders in the future. In fact, the extent of neurological consequences of COVID-19 have been such that large-scale global research collaboratives have been urgently assembled to evaluate acute neurological events of the pandemic, which in time will hopefully allow us to better understand the effects the disease can have on the brain and what we can do about it. But what do we know so far? How could the virus potentially be affecting our brains like this? There are two main groups of mechanisms by which COVID-19 could be causing its neurological effects: indirectly and directly. In the first case, infection with the novel coronavirus may have a detrimental impact on the brain by a mechanism analogous to why we see so much respiratory pathology, the effects of our own body's response to the virus. One of the first features of COVID-19 to capture public attention was the increased risk of blood clotting seen in the disease. This hypercoagulable state induced by the disease is well documented at this stage, and clots in the brain resulting in ischemic strokes and death of brain tissue have been a significant consequence of the disease in hospitalized patients, even in younger cohorts. Even more insidiously, the novel coronavirus has the ability to infect the cells lining our blood vessels, resulting in dysfunction of this vital layer, which not only increases our risk of these big disruptions to the blood flow resulting in organ infarctions such as strokes, but also disrupts blood flow through the tiny and microscopic vessels, and thus impair flow to the brain on a more global basis, a situation made even more serious given the low oxygen levels in the blood to start with that are characteristic of this disease. The effect on endothelial cells can be such that the vital barrier between the blood and brain can also become compromised, the implications of which I will discuss later in this video. Blood hypercoagulability is part of the body's innate global inflammatory state, a process which includes the release of cytokines into the circulation. In COVID-19, we see a dysregulation of this part of the response to the viral invaders, the so-called cytokine storm, that was also one of the first features of the disease to hit the headlines early on in the pandemic. More commonly associated with the respiratory manifestation of the disease and thought to be a bigger contributor to lung damage than the direct effects of the virus, it has been proposed that an analogous mechanism of damage by the cytokine storm might be at play in the central nervous system, and I will discuss how later on. Our own immune system in general, its effects I have mentioned, and others such as high fever and the systemic inflammatory response syndrome may be a part of the mechanisms of the various neurological syndromes which may occur in both the acute phase of the disease and the post-infectious phase. It is even thought that there is potential for the immune system to specifically target our central nervous system following recovery from the disease by autoimmune processes. Again, I will explore this feature in more detail later on. As we are appreciating more and more these days with disease in general, the intestinal microbiome and gut inflammation may play a role in the effects of COVID-19 on the brain. The novel coronavirus can cause prolonged infection in the gut, and it is speculated that changes in intestinal microbiota precipitated by infection with the coronavirus may cause neuropsychiatric symptoms via the gut-brain axis, the multimodal communication of the intestine with the brain, and a new concept in medicine which I have discussed on this channel previously. We are not yet sure if the coronavirus reaches the intestine by spread from the circulatory system or if it can get there via the mouth. But certainly any measures we can take to give our friendly bacteria the best possible chance to protect us and maintain the integrity of the gut barrier will help prevent complications of this aspect of the disease, such as translocation of pathogens, toxins, and inflammatory products from the gut to the circulatory system and worsening of the cytokine storm, with the potential to increase severity of the disease and impact organs such as the brain. I mentioned earlier that there are two main groups of mechanisms that the novel coronavirus can affect our brains, indirectly and directly. The gut may also provide a conduit by which the virus can make its way into the brain itself and affect it directly. Alarmingly, it has been suggested that it is possible for the virus to travel up these nerves connecting the gut to the brain and gain access that way. This same pathway of invasion has been proposed via nerves to the nose and mouth, which makes sense given the frequency with which we see long-lasting loss of sense of smell and taste in the absence of rhinitis and nasal obstruction as a symptom of the disease. It may also occur via nerves to the lungs themselves. One intriguing, if not disturbing, feature of COVID-19 is that some patients presenting with low levels of oxygen in the blood do not seem to be able to sense this aberrant physiological state they are in. Hypoxemia is an abnormally low level of oxygen in the blood, often accompanied by aberrations in other blood gases, and this is normally very uncomfortable with the patient experiencing breathlessness and the body responding in several ways to bring the oxygen levels back to normal. And indeed, breathlessness is one of the cardinal symptoms of COVID-19. But in some patients, a state of so-called happy hypoxemia develops, where the patient does not experience these symptoms and their body doesn't respond to the situation properly. The brainstem is a critical area of the brain involved in regulating autonomic responses, such as rate and depth of breathing. Many of the organs we've discussed so far have a neural connection to the brainstem, such as the gut, lungs, mouth, and nose. And it has been hypothesized that the virus might be traveling to the brain via these nerves into the brainstem, where it may be impairing the function of this vital part of the brain. We might be happy, but our brains might not be. This to me raises interesting questions about how the virus can inflict such devastating effects on some patients' respiratory physiology. Perhaps a process by which the virus gets into the brainstem early on in the course of the disease might impair the autonomic response, such as increased work of breathing and coughing that would normally take place in response to and as an essential part of our fight against a viral respiratory tract infection and aberrant blood gases, thereby making it easier for this virus to infect and replicate in the patient as it makes its way further down the respiratory tract, and partially explaining why it can cause such uniquely severe respiratory disease and loss of function in some people. I couldn't find much more on this in my reading other than what I've already presented in this section, but hopefully this is a hypothesis we'll see tested in future research. Some of you may be thinking, surely the coronavirus could just get into the brain directly from the blood vessels supplying the brain once it makes its way into the blood instead of travelling all the way up a nerve in this way. Fortunately, the brain benefits from extra protection from the blood, afforded by specialised cells and structures that form an extra barrier in addition to that provided by the endothelial cells found in all blood vessels. Amongst other functions, this blood-brain barrier blocks the ingress of almost all pathogens, making blood-borne infections of the brain rare. Apart from potential circumvention mechanisms such as hiding inside peripheral immune cells to sneak into the central nervous system, Evidence has emerged recently that suggests that the blood-brain barrier might not be such a barrier to this novel coronavirus after all. To learn why, we must turn our attention to the now famous ACE2 receptor. Normally involved in regulating processes such as blood pressure, clotting, and inflammation, ACE2 has gained fame for offering the main entry mechanism for the novel coronavirus into cells, and it is expressed on the cells lining the respiratory tract and in the lungs themselves, but also critically in nerve tissue and in the specialized lining of the nose. It is also highly expressed on the cells lining the intestine. These features help explain how the virus can potentially gain access to the nervous system via the lungs, gut, mouth, and nose, as we have discussed. But another critical area where ACE2 is expressed is on the cells lining our blood vessels, including those supplying the brain. I mentioned earlier that the virus can infect the endothelial cells lining blood vessels, and it does this by binding to ACE2. But we still have not yet answered how the virus may get from the blood to the brain. Remember, there is still that other component of the blood-brain barrier, the extra protective cells and structures enjoyed by the blood vessels supplying the brain specifically. This is where we begin to see many of the pathological processes of COVID-19 discussed previously act synergistically to allow the virus to directly access the brain from the blood. The COVID-19 cytokine storm, as we explored earlier, as well as inflammation in general, have the potential to disrupt the blood-brain barrier, thereby facilitating entry of the virus, which stimulates the local release of more cytokines, inducing a cytokine sickness with the potential to cause encephalopathy. Some of these cytokines themselves have known neurotoxic potential. When combined with some of the other indirect effects of the virus on the brain we've explored so far, you can see how the effects of the disease really start to add up and spell bad news for our poor brains. These processes may form part of a positive feedback loop, with more breaking down of the blood-brain barrier and further entry of the virus potentiated by this inflammation. The novel coronavirus looks to be causing more trouble by binding to ACE2 than simply gaining access to our cells, however. While bound to and cleaved by the virus, the enzyme is unable to perform its usual anti-inflammatory, anti-thrombotic functions, possibly posing another way that COVID-19 induces disruption to blood flow to the brain by endothelial dysfunction and atherogenesis, and also some of the other features like oxidative stress and inflammation that are normally attenuated by this key enzyme. This may be part of the reason we see an association between infection with the virus and stroke and vasculopathy in both young and old patients. A normally functioning vascular endothelium also plays a key role in the autoregulation of blood pressure in the brain, and this process may be disrupted during COVID-19. At a local level, ACE2 serves to increase flow and reduce pressure of blood by dilating blood vessels as required on a reactive basis, a function it likely cannot perform when bound to the virus, potentially resulting in arterial wall rupture and bleeding into the brain due to the high pressures. And at a systemic level, ACE2-mediated entry into the hypothalamus offers not only another potential gateway to the entire brain, but through its actions on this central link of nervous system to endocrine system result in body-wide dysregulation of blood pressure through the release of adrenaline and other hormones, a situation made worse by the fact that circulating cytokines from the cytokine storm have the same blood pressure raising effect on the hypothalamus. Invasion of the hypothalamus and other areas involved in blood pressure control is thought to be one of the reasons we see hypertension feature strongly in COVID-19. And this situation, combined with the local dysregulation of blood pressure in the brain, is a recipe for catastrophic consequences. As well as blood pressure, the novel coronavirus may also strike other areas of the brain critical for the regulation of other physiological processes. In addition to access through peripheral nerves discussed previously, it has been proposed that this ACE2-mediated invasion of the brain could also be to blame for the brainstem failure and consequent respiratory failure and sometimes happy hypoxemia we see in the disease, since as we saw earlier, it is the brainstem that controls breathing. ACE2 is expressed in key brain regions involved in controlling respiration. This theory is especially plausible given that some of these regions lack the extra protection of the blood-brain barrier. There are numerous other entry points to the brain from the blood for viruses. The potential for the novel coronavirus to exploit these is yet to be fully explored. Once in the brain, the virus can cause neuroinflammation and neuronal death and a range of pathologies, again due to the dual effect of the virus itself and our body's response to it. Evidence has emerged recently that it can replicate in neurons, as evidenced by autopsy and experiment, with high replicative potential, and it is possible that the increased metabolic demand of viral replication in infected neurons would deprive oxygen to neighbouring healthy cells. Increased blood-brain barrier permeability facilitates translocation of immune cells into the brain, where they can cause damage whether they themselves are infected or not, as part of our body's fight against the virus. The brain's own defensive and supportive cells may also expand brain inflammation in response to pro-inflammatory signals in a maladaptive fashion in COVID-19, while at the same time reducing their usual neuroprotection and metabolic support functionality, whether or not they themselves become infected. This reduced functionality includes reduced clearance of neuron-stimulating mediators, which can then build up to the point where neurons fire uncontrollably, resulting in seizures and damage to and the death of the affected neurons. The pro-inflammatory activation of these innate defensive cells may also be precipitated by the reduced function of ACE2. Once activated, these support cells may again react inappropriately, resulting in a reduction in their ability to maintain the blood-brain barrier and promoting neurodegeneration. Even when we clear the infection, the battle is not over. The profound priming of the immune system by these processes might induce nerve damage even after the infectious illness has passed, and we have reports of catastrophic immune-mediated neurological diseases like acute disseminated encephalomyelitis and acute necrotizing encephalopathy related to COVID-19. Importantly, some patients have not even had the warning of the usual COVID-19 symptoms before developing neurological sequelae. And although emphasis is rightly put on the recovery from the acute phase in patients with COVID-19, if the virus does invade the brain, there is the potential for it to remain latent there before reappearing later, perhaps years into the future, and causing neurological manifestations then. Of course, we are still very early in our study of this disease, and many of these complications are not fully explored or proven yet, and some are quite rare. But when you consider that it is hypothesized that the severe hypoxia that is characteristic of COVID-19 is enough to cause brain swelling and ischemic stroke on its own, it's not hard to see how if even one or two of these other potential mechanisms come into play, that our brains can very quickly come under threat when we become infected with the virus. As we have seen, many of these processes interact and work together to wreak havoc on our nervous systems when we become infected with the novel coronavirus. It's just not worth the gamble. If all of this stuff is enough to scare you, you're not the only one. Taking a step back from COVID-19 pathophysiology, one aspect of the pandemic-stricken world we now live in that is often neglected is the psychological aspect of living in a world with frequent lockdowns, quarantine, decreased social interaction, decreased physical activity, worries about the future, job losses, and economic downturn. This has led not only to fear around the globe, but also stress, anxiety, depression, insomnia, denial, and anger. And as we are seeing more and more now, infected patients may also have to deal with guilt and stigma, and these emotional problems may reduce immunity and compromise recovery, as well as predispose towards psychiatric problems. There are both physical and biopsychosocial aspects to this disease. Psychiatric morbidity is of particular concern given the link between psychiatric illness and systemic inflammation when you consider the inflammation we see in COVID-19. And for those who manage to avoid infection, all these societal changes may increase psychiatric problems anyway. A healthy lifestyle, regular exercise, balanced nutrition, quality sleep, and a strong connection with families and communities are all associated with a boost to the immune system, as well as being good for our heads, and they are all reduced as a side effect of the measures employed to fight the pandemic. So that's a lot of potential ways the virus could affect our poor brains. The question is, what do we do about it? Of course, the best way of avoiding most of these consequences is to avoid becoming infected in the first place by following the latest public health advice. But the novel coronavirus is very infectious, and even with best practice, we may still become infected. What then? Part of the problem with coming up with ways to combat COVID-19, and indeed viral infections in general, is that there tends to be a paucity of specific treatments for them for reasons beyond the scope of this video. There has never been an effective specific treatment developed for measles, mumps, or rubella. Instead, we deal with the causative viruses by preventing these infectious diseases in the first place with vaccination, and providing best supportive care to allow the patient that does become infected to overcome it themselves. Like these other viruses, the best treatments we have for COVID-19 are non-specific and of limited efficacy, and the central tenet of care has been supportive, allowing our own body to fight off the infection. Also, none of these treatments have been tested against the neurological aspects of COVID-19 specifically as of yet. But this should provide us with a clue as to how we might prevent some of these severe neurological effects of the disease, by optimizing our own ability to fight the virus and to modify our risk of getting severe disease. This is good news in a way. If we do some simple things right, we can combat all of the effects of the virus at the same time by letting the infinite wisdom of our own body do the work. There are many diseases, including other infectious diseases like tuberculosis and cholera, that we often cannot fight well on our own and require specific medical interventions to overcome. Medical interventions that are very effective, but that we unfortunately do not have for COVID-19. But the flip side of this is that we can win the fight against most viral infections on our own if our bodies are given the time to do so, and the novel coronavirus is no exception. We can also modify our risk of getting severe disease in the event that we do become infected, and severity appears to be the most important factor for predicting neurological effects. In the limited amount of data we have so far, it is clear that those with less severe disease have several times less risk of developing severe neurological sequelae compared to those with more severe systemic presentations. So what can we do to help ensure we only get a mild course of COVID-19? And how do we give ourselves the best chance of fighting this virus? As I have said, no intervention to prevent or treat the neurological sequelae of COVID-19 has been tested directly. However, nutritional status plays a significant role in patient outcomes in other viral infections, and I'm going to propose why I think a whole foods, plant-based diet sufficient in vitamin D, zinc and selenium, due to its safety and ease of application, is well placed to have a key role in the challenge of keeping healthy people healthy, and is the single most important thing you can do to look after your brain during this pandemic, outside of avoiding the virus altogether. The evidence for this is limited, like it is for all current COVID-19 interventions, but the great thing about adopting a healthy diet is that it is safe and the side effects are all good ones. The same cannot be said about drugs, convalescent plasma or invasive ventilation. I will link to my past videos with timestamps to the relevant parts in the description box, in case you're interested in following up any particular part further. Like so many of our top non-communicable diseases in the modern world, one central unifying mechanism by which the novel coronavirus attacks the brain is through inflammation. As we have seen, this inflammation leads to the breakdown of the blood-brain barrier, can be directly neurotoxic, contributes to endothelial dysfunction, atherosclerosis, coagulopathy, and their resultant deprivation of oxygen to the brain. This situation is made worse by the fact that the anti-inflammatory effect of ACE2 is attenuated by this disease. The natural, powerful anti-inflammatory effect of a healthy whole foods plant-based diet is likely to help mitigate these inflammatory effects. As I've explored on my channel in the past, a healthy diet improves endothelial function, can reverse atherosclerosis, and reduces oxidative stress. Through its effects on brain inflammation, a healthy plant-based diet is powerful enough to relieve depressive symptoms and boost our mood. It is the best thing we can do for our intestinal microbiome, which gives us the best chance of fighting the coronavirus on this front and denying it access to the brain this way. A whole foods plant-based diet can reverse hypertension, one of the key risk factors for severe COVID-19 that is seen in younger patients as well as older. Avoiding animal products and focusing on whole plant foods helps prevent autoimmunity, stymieing this potential long-term effect of coronavirus on the brain. A whole foods plant-based diet may be such a catch-all magic bullet for fighting COVID-19 brain effects, in fact, that of all the mechanisms I've explored in this video, the only one I could not find any positive effect of this diet on is the retrograde axonal transport of the virus up the nerves to the brain. And not only this, but remember, having a severe disease course is the strongest predictor of neurological sequelae in COVID-19. And if you consider the biggest modifiable risk factors for severe COVID-19, many of them are some of our most well-known and common chronic diseases, largely caused or at least contributed to by a bad diet, and are also sometimes reversible with a healthy enough whole foods plant-based diet. The reversible nature of some of our top chronic diseases provides an ideal opportunity to reduce incidence of severe COVID-19 and its neurological consequences. But unfortunately, as we so often see, the focus has remained on using drugs instead of diet to perform this task. Good nutrition has been highlighted during this pandemic, not only because of the link between diet, chronic disease, and severe COVID-19 presentation, but also as a way to modulate our immune systems. Remember that COVID-19 is characterized by maladaptive, out-of-control activation of our innate immune system, and attempts at indiscriminately boosting our immune system could do more harm than good. This is one of the biggest challenges we face with this disease. Likewise, we don't want to damp down inflammation to the extent that our ability to fight the virus is compromised. Given how complex our immune system is, it makes sense that we should allow the infinite wisdom of our own bodies to find this balance by providing it with good nutrition, rather than just trying to emulate the process with yet more drugs. Underestimation of the crucial role nutrition plays in the disease can dramatically affect COVID-19 outcomes. Conversely, consumption of the standard Western diet has the opposite effect of what we want. It activates the non-specific, pro-inflammatory part of our immune system while impairing specific adaptive immunity and our ability to fight viruses. We must remember that the vast majority of COVID-19 patients are expected to recover, but the inflammation caused by COVID-19 may have long-term consequences in survivors, including neurological consequences like dementia and neurodegenerative diseases, especially given the causative contribution the standard unhealthy diets most people eat have to these conditions. The profound challenge to the immune system posed by COVID-19 could bring these diseases forward by many years for those susceptible to them. We may see a spike in chronic diseases as a result of this pandemic, compounded by the unhealthy diets we already had before it. So basing our diets around healthy whole plant foods and cutting out animal products and junk is now more important than ever. In addition to focusing on healthy, high-fibre whole plant foods to reduce the risk of severe brain effects from coronavirus, I just want to briefly touch on why I think there are a few key nutrients we should specifically emphasise at this time as well. Vitamin D deficiency is common, and this is an even bigger problem during the winter months. It has been hypothesised that vitamin D deficiency contributes to risk of severe COVID-19 due to its integral role in immunity and inflammation, including modulating some of the cytokines involved in the COVID-19 cytokine storm. As with all COVID-19 interventions, the data on vitamin D so far are equivocal, but research so far suggests that increasing vitamin D intake may be helpful in COVID-19 to the extent that formal trials have been initiated, especially in people who are deficient. Until we know more, I think ensuring an adequate vitamin D status is a safe strategy that is unlikely to cause harm, but could help prevent severe COVID-19. I haven't yet covered vitamin D in my Nutrients of Concern series, but I will address form, dosing and other issues in that video in the future. Likewise, suboptimal zinc status is very common, and this micronutrient is also integral to the functioning of our immune system as it pertains to COVID-19. Zinc may also interfere with coronavirus biology and has been used with some success as a folk remedy for the common cold, which can be caused by coronaviruses. Like vitamin D, zinc is cheap, safe and easy to get. And despite there being no hard evidence for its benefit in COVID-19 specifically yet, I think it is worth adding to your supplement stack while this pandemic is with us, if you're at risk for insufficient intake. I've recommended zinc supplementation in any case for certain cohorts, and I address this matter further along with dosing strategies and people who may be at risk of insufficiency in my video on this micronutrient, which I will link below. I also want to give an honourable mention to selenium. Insufficient levels of selenium intake have been observed in large parts of Europe, and selenium deficiency was implicated in the pathogenesis of the disease caused by the first pandemic coronavirus, and it has been observed that those who died of COVID-19 had lower intake of this nutrient in some small observational studies. Of particular interest in this current pandemic is that an enzyme strongly dependent on selenium supply interacts with one of the main enzymes of the novel coronavirus responsible for its replication. But ensuring an adequate supply of selenium is easy. Just eat a small handful of Brazil nuts every so often. Selenium is also an essential cofactor in a group of enzymes that reduce oxidative stress, which as we know is a key element of the pathogenesis of COVID-19. And even if we still need more research to determine how big of a role this nutrient plays in the disease, when it's so easy to put up this extra little fight, why not do it? Just don't overdo it. Brazil nuts contain so much selenium that it is easy to exceed the tolerable upper limit with this food. While we're on the topic of selenium, some of these enzymes also require adequate levels of the antioxidant glutathione for optimal functioning, which is easily depleted in conditions of oxidative stress, such as COVID-19. This is the main rationale behind the administration of N-acetylcysteine for COVID-19, which essentially acts as one of the rate-limiting building blocks of glutathione. Because the otherwise healthy patient hoping to avoid or prevent a severe course of COVID-19 has sufficient dietary intake of alternative precursor nutrients and should not have these problems with excess mucus production, the role for N-acetylcysteine may be restricted to sicker COVID-19 patients, and I cannot recommend it as a general prophylactic measure based on current evidence until we know more from trial data. This goes for other nutrients as well. If you are unfortunate enough to have a severe course of COVID-19, requirements for all other nutrients may change drastically, including the ones I have discussed in this video, so please follow the advice of your own medical team in that case. It is worth noting as well that ensuring adequate supply of the three nutrients vitamin D, zinc and selenium may be especially important for those with risk factors for severe COVID-19 like diabetes, high blood pressure and heart disease. The immunocompetence promoting effect of these nutrients may help counter the inflammatory aggravation that is thought to be part of the reason why patients with these comorbidities are at a higher risk of severe COVID-19. But for all people, it has been hypothesized that these three nutrients promote resistance to the life-threatening inflammatory cytokine storm, which as we have seen can be neurotoxic, and it is important to have a good status of these nutrients before becoming infected. This is a simple, cheap and harmless strategy to employ against COVID-19. Just don't overdo it with the dose. All three have tolerable upper intake levels for a reason, and more is not always better. There are many other nutrients purported to offer benefit in COVID-19, like vitamins A, C and D, soluble and insoluble fibre, antioxidants, and countless phytochemicals, all of which luckily can be plentifully sourced and safely dosed in a balanced, whole foods, plant-based diet. This should be plenty of motivation to get your diet in order, with a sensible supplement regimen if necessary, and give yourself the best chance of avoiding COVID-19 neurological complications. If there's anything this COVID-19 pandemic has demonstrated, it's that if there is a collective will, action can happen. There may be a silver lining in it if we can use the massive public attention on coronavirus and the hunger to find ways of combating it to get the message out there about the powerful, evidence-based tool we have for reversing the tide of chronic disease with simple dietary changes, and with it the risk of severe COVID-19 and neurological effects. The current COVID-19 pandemic has been a game changer for nutrition science, and for the first time, the spotlight is on the role of Western dietary excess in an infectious disease, rather than the usual chronic diseases we associate with overconsumption of unhealthy foods. The COVID-19 pandemic provides nutrition researchers and educators new opportunities to inform the public about the potential life-saving benefits of good nutrition and healthy eating, something I've hopefully achieved with you if you've made it this far. While it may be too late for some, there is still time for others to begin preparing their bodies and physiologies for the next infectious pandemic. Hopefully this will be an opportunity to introduce a whole new cohort of health-conscious people to a plant-based, active, healthy lifestyle. In summary, neurological symptoms are very common in COVID-19, such as fatigue, headache, and loss of sense of smell. So we know the disease is quite commonly having neurological effects on some level. There is a myriad of potential ways the novel coronavirus could damage the brain beyond the obvious, but we are very early in our study of this aspect of the resultant disease. Indirectly, the virus can impact the brain by the formation of blood clots, impairing blood flow and its autoregulation, through the severe hypoxemia and aberrant inflammation we see in COVID-19, and also by autoimmunity, breakdown of the gut barrier allowing ingress of neuroactive substances, and through psychiatric effects like anxiety and depression. The virus can also enter the brain directly through nerves to multiple organs or from the blood, where it can go on to impact parts of the brain that control breathing and blood pressure and cause pathology secondary to brain infection or through the resultant priming of the immune system. The virus may also remain latent in the brain with the potential to resurface in the future. The best thing you can do to avoid neurological consequences of COVID-19 is first of all to avoid becoming infected, then to avoid a severe course of the disease in the event you do become infected. A healthy, whole foods, plant-based diet may be one of the best things you can do to reduce your risk of having a severe course. This same diet will also help reverse many of the top risk factors for a severe course. This diet may also have a direct effect on many of these mechanisms by which the novel coronavirus could damage the brain. Vitamin D, zinc and selenium are nutrients that may be of particular importance to have a good supply of during this pandemic, in addition to the many others already conveniently found in abundance in a healthy, balanced, whole foods, plant-based diet. I would just like to finish on one final thought. Depending on your own personal circumstances, you might think you'll be all but certain to survive this infection. You might think you'll feel fine after a few days. But the simple fact remains, we just don't know what or how frequent the long-term consequences are going to be. How will you be 5 years down the line? How about 10 or 20? Of course, one of the biggest risk factors for severe COVID-19, and hence the neurological sequelae outlined in this video, remains advancing age. But even if you're at a low-risk age, please take the preventative measures very seriously. You might be fortunate and avoid these effects, but do you really want to be responsible for inflicting these devastating neurological consequences on someone else? The best thing overall you can do to avoid an attack on the brain by COVID-19 for yourself and for others is to avoid the virus altogether. All of the other advice I have given in this video remains secondary to that. If you clicked on this video, you must be interested in preserving the health of your brain. Now more than ever is the time to center our diets around whole plant foods to give ourselves the best chance possible of protecting the brain from the neurological consequences of COVID-19. But even outside of COVID-19, one of the best things you can do for your brain is to adopt a healthy, balanced, whole foods, plant-based diet, as I've explored extensively on this channel in the past. Look after yourselves, guys. Skip the processed crap and animal products. Eat them whole plant foods, and I'll see you next time.